Welcome to today's lecture on tuberous sclerosis complex, TSC. TSC is a rare genetic disorder that affects multiple systems in the body, including the brain, skin, kidneys, heart, and lungs. It is characterized by the formation of non-cancerous tumors, known as hamartomas, in various organs. In this lecture, we will explore the pathophysiology, clinical manifestations, and management strategies of TSC. So let's dive into the fascinating world of TSC. TSC is caused by mutations in either the TSC1 or TSC2 gene, which encode for proteins called hamartin and tuberin, respectively. These proteins are involved in the regulation of cell growth and proliferation. Loss of function mutations in either gene leads to the dysregulation of the mTOR signaling pathway, which plays a crucial role in cell growth and differentiation. Consequently, uncontrolled cell proliferation occurs, giving rise to the formation of hamartomas in various organs. In TSC, the brain is one of the major organs affected. Characteristic findings include cortical dysplasia, which refers to abnormal development and organization of neurons in the cerebral cortex. These dysplastic neurons form cortical tubers, which are associated with a range of neurological symptoms, including epilepsy. Additionally, the presence of subependymal nodules, another type of hamartoma, along the ventricular walls can lead to the development of subependymal giant cell astrocytomas, SAGAs. Subependymal giant cell astrocytomas, SAGAs, are neoplastic growths that originate from the aberrant proliferation of astrocytes, a type of brain cell. These tumors typically arise adjacent to the ventricles, which are fluid-filled spaces within the brain. Owing to their locational proximity, SAGAs often cause obstruction of the normal flow of cerebrospinal fluid, resulting in a condition called hydrocephalus. This occurs due to the increased size of the SAGAs impeding the circulation of fluid in the ventricles. To alleviate symptoms and prevent complications such as elevated intracranial pressure, surgical intervention is commonly necessary. The surgical approach consists of either complete resection or reduction in size of the SAGAs. Tuberous sclerosis is a medical condition that often leads to epilepsy, a neurological disorder characterized by recurring seizures. Over 85% of individuals with tuberous sclerosis experience seizures. These seizures can have various forms, such as focal, limited to a specific area of the brain, generalized, affecting the entire brain, or infantile spasms. Diagnosing and treating epilepsy early is essential to minimize developmental delays and cognitive impairments associated with tuberous sclerosis. Proper management of epilepsy in individuals with tuberous sclerosis is crucial for improving patient outcomes. Targeting the dysregulated mTOR pathway has shown promising results in the management of TSC. Drugs such as everolimus and sirolimus, which are mTOR inhibitors, have been approved for the treatment of certain manifestations of TSC, including renal angiomyolipomas and SAGAs. These medications help to reduce tumor size and control symptoms, offering a more targeted approach to TSC management. Facial angiofibromas are one of the cutaneous manifestations of TSC. These reddish papules or nodules typically appear on the cheeks, nose, and chin, and their development is attributed to the proliferation of fibrous tissue and blood vessels. Laser therapy and topical treatments can be utilized for cosmetic purposes and to improve quality of life in affected individuals. Renal involvement is a significant feature of TSC, with renal angiomyolipomas being the most common renal manifestation. These benign tumors consist of adipose tissue, smooth muscle cells, and blood vessels. Regular imaging surveillance is necessary to monitor their size and the risk of complications such as hemorrhage. In severe cases, intervention may be required to prevent renal function impairment. Lymphangioliomyomatosis, LAM, is a rare lung disease that primarily affects women with TSC. LAM is characterized by abnormal proliferation of smooth muscle cells in the lungs, leading to the formation of cysts, airflow obstruction, and progressive respiratory impairment. Management includes close monitoring of lung function and the use of medications such as mTOR inhibitors to slow disease progression. Cardiac rhabdomyomas are non-cancerous growths that originate from the muscle cells of the heart. These tumors are frequently observed at birth or identified during prenatal ultrasounds. Although they typically diminish on their own with time, it is important to closely monitor the heart for potential complications, such as irregular heart rhythms, arrhythmias, or blockage of blood flow. Regular cardiac assessments are necessary to ensure timely intervention and proper management if any issues arise. In tuberous sclerosis complex, TSC, a genetic disorder affecting the brain, individuals often face difficulties in cognitive function and behavior. These challenges can vary in severity, from mild learning disabilities to intellectual disability. Additionally, many individuals with TSC also experience attention deficit hyperactivity disorder, ADHD, alongside their cognitive impairments. However, early intervention through educational support and behavioral therapies has proven effective in improving outcomes and enhancing the quality of life for individuals with TSC. In recent years, there have been significant advancements in imaging techniques for the evaluation of tuberous sclerosis complex, TSC. One such technique is magnetic resonance imaging, MRI, which uses powerful magnets and radio waves to create detailed images of the brain and other affected organs. Another technique, positron emission tomography, PET, involves the injection of a small amount of radioactive material into the body to detect functional changes. These imaging modalities enable doctors to visualize structural abnormalities, metabolic changes, and functional alterations in TSC, thereby facilitating precise diagnosis and treatment planning. Tuberous sclerosis complex, TSC, is a condition that affects the brain and other organs, leading to various neuropsychiatric disorders collectively known as TSC-associated neuropsychiatric disorders, TAND. Some common TAND conditions include autism spectrum disorder, ASD, attention deficit hyperactivity disorder, ADHD, anxiety, mood disorders, and intellectual disability. These conditions require a comprehensive approach involving neurologists, psychiatrists, and behavioral therapists to effectively manage the complex neuropsychiatric symptoms associated with TSC. In conclusion, tuberous sclerosis complex, TSC, is a fascinating genetic disorder that affects multiple organ systems, particularly the brain, skin, kidneys, and lungs. The identification of TSC1 and TSC2 genes has enhanced our understanding of the pathophysiology of this condition, leading to the development of targeted therapies such as mTOR inhibitors. Early diagnosis, comprehensive management, and coordinated care involving various healthcare professionals are crucial in improving outcomes and quality of life for individuals with TSC. Thank you for joining me in this educational journey into the depths of TSC.